This is Billy Ball, managing editor at Cardinal Pine. Thanks for joining us today. I'm talking with Dan Mulcrone, who is the medical director in the intensive care unit at Centera Albemarle Medical Center, which is out of Elizabeth City, North Carolina, in Pasquotank County, in the northeastern corner of the state, where coincidentally I'm from. So I've got some love for the area. So Dan's here to talk to us about the experience that they've had down in Pasquotank, which at this point, according to DHHS, has had 34 confirmed COVID cases and one death out in the community. So first off, Dan, thanks, by the way, for taking a few minutes to talk to us.
It's my pleasure, Billy. I really appreciate you having me on.
Absolutely. So first off, tell me a little bit about yourself, what your job duties are, and what that's like on a daily basis.
Sure. So as you already said, I'm the medical director of the intensive care unit at Centera Albemarle Medical Center in Elizabeth City. It's a 10-bed ICU. It's mixed medical and surgical patients. And I work alongside my partner, Dr. Teresa Hartzell, who is also a staff intensivist here and anesthesiologist. And together we manage the unit. We typically run a census of about 8 to 10 patients on any given day. And in terms of the latest COVID pandemic, this is where a lot of our sicker patients do present.
Okay. So tell me a little bit in the build up here that we had in the months up to now. There was sort of a different reaction from the federal government and the states, but tell me a little bit about your preparation process there as you folks were learning that obviously COVID's going to make its way into the United States and it'll almost certainly make its way into Pasquotank County. How did you prepare?
Sure. So I think one of the advantages that we have as a small hospital in a rural setting is that it was unlikely that we would get one of the first waves. So we had the advantage of learning from a lot of other facilities in more population dense areas in terms of what their preparation strategies were and what our actual needs may be. So we took the time to really do our homework as far as the burden on resources and staff that other places were experiencing, and we're able to prepare as much as possible. We did stockpile as much personal protective equipment as we possibly could. We made arrangements to expand our ICU coverage, open up new ICU rooms if we needed an overflow area. And we also cross-trained staff, both from a nursing standpoint and a physician standpoint, to help manage any surge of patients that we had. So from an equipment standpoint, from a personnel standpoint, and from a geographic resource standpoint, we were as prepared as you could be.
How's that stockpile holding up? We know some counties were really seeing a shortage of masks and gowns. You know, how's it holding up down there?
Well, of course, that was a fear of ours, that we wouldn't have the protective equipment that was necessary to protect ourselves and to protect transmission to other patients that did not have the disease. What I can say with a high degree of certainty and confidence is that we have not been in a situation where we have not had what we needed. Centera as a healthcare system, as well as Albemarle Hospital, really did an admirable job at preparing the stockpile. And I think the staff at the ground level has done an excellent job at being resourceful and efficient in terms of entry and egress from the patient rooms and the amount of personal protective equipment that we need.
Gotcha. So it sounds like obviously you're not in the kinds of dire straits that other areas have had to go through at this point.
Yeah, I think, you know, that's a correct statement. We are not in dire straits as other places are. And I think that's a testament to the preparation and the multiple levels of discussion that we had leading up to any influx and surge of patients.
Gotcha. So there's a lot of conversation up at the state level right now about lifting some of the social distancing guidelines that Governor Cooper has put out there. Obviously, as you're probably pretty well aware, there was a pretty significant protest in Raleigh last week Where do you stand on this as a medical provider? What would you like to see the state do going forward?
Well, I'll tell you what, it's always a debate. I think there's two schools of thought. And of course, one school of thought is that we cannot sustain this level of quarantine forever. It does take its toll on not only the economy, but it also takes a toll on the citizens of our city and our state. And that's understandable. The other school of thought, of course, being that any social interaction and any laxity of the social distancing rules certainly could lead to additional spread of the disease and a second peak in the cases that we see. So our hope is that when social distancing cues are minimized, that the citizens of our city and our state still take the disease fairly seriously.
Mm-hmm.
Hand washing techniques, shaking hands, personal contact, all of those will still matter. And I think it's because we've put limits on that we haven't seen quite the numbers that we were expecting to begin with.
Mm-hmm.
And I think that's a result of the limitations on personal contact, not in spite of it. So what we hope is that people continue to be mindful of the possibility of contracting this illness, and that if we relax the social distancing rules too quickly, that we could see a peak of cases that could easily overwhelm local healthcare systems.
Mm-hmm. So it sounds like you think that it's too soon to be talking about lifting those social distancing restrictions. I know some of the protesters are asking for those orders to be lifted as soon as the end of this month. Is that too soon or to be talking about that?
I don't think there's any time that's too soon to be discussing it. I don't think that opening, quote unquote, opening the state is as easy as snapping fingers and getting back to a normal life, if you will.
Mm-hmm.
I think discussions need to take place about selectively opening places that are more necessary to day-to-day life, and then how we screen people. Does there need to be screening? If so, how are we going to do it? Is it going to be temperature regulation? Is it going to be, checking for symptoms? Is it going to be swabbing everybody? And I don't think those answers are quite clear.
Mm-hmm.
Unfortunately, the proof may be in the pudding, and once we open up, then we'll understand to a much greater deal how much of an effect that social distancing actually has.
Mm-hmm.
But it's also one of those things where it's a severe enough disease that we do have to take it quite seriously, and do this in a smart, organized fashion.
Mm-hmm.
And hopefully people understand that. And it's interesting, Billy, I have to say that in our particular community, I think people do understand that. It's very rare to go out and see anybody without a mask on or anybody not social distancing. All the local stores, all the local businesses that remain open, everybody is taking those precautions.
Mm-hmm.
So I'm quite confident and optimistic that people will continue that as we start to reopen.
Mm-hmm. And, I've heard some legislators and protesters suggest why not lighten up in areas where we're seeing much less of a caseload right now. I know the state is reporting COVID in 95 of 100 counties. That said, obviously, we have to say that those numbers are probably an undercount, and it's depending on the number of people who are coming in and testing when they have the COVID symptoms. So, what's your reaction to the idea of relaxing restrictions for some counties, but trying to maintain them in some of the urban areas where
I think you raise multiple good points here. And I think one of the main points is that we don't know what the denominator is here. We don't know how many people actually have the disease that have not tested positive for it or not been tested at all. So I don't think that we have accurate data in terms of the case burden.
Hmm.
That said, based on the information that we do have available, it's difficult to tell what is the cart and what is the horse. You don't know if the case count is small because of social distancing, um, or is it in spite of social distancing, and there are some areas that are not as prone to disease transmission for one reason or another.
Hmm.
I think the fear is that by opening up places that are not as affected, those places then become affected.
You know, we have seen, as I mentioned before, those varying reactions from the levels of government. Donald Trump at one point was pretty dismissive of COVID before becoming more serious about it. We've had protesters who've been very critical of Governor Roy Cooper's approach to handing out these social distancing orders. What is your message for people that you really want there to be a takeaway of when it comes to the criticism of government leaders who are really going with very strong restrictions?
Sure, and I think first and foremost, I need to point out that any opinion that I have in terms of governmental response is not the opinion necessarily of Sentara or Albemarle Hospital. Um, I, on a blanket level, on the other hand, I think that it's always important to listen to the people who have particular expertise in a field. Now,
Mhm.
politicians are by definition public figures, and to a degree, they've got the responsibility of spreading information and making important decisions.
Mhm.
I applaud the ones who are listening to medical advice
Mhm.
by nature, and I think it's a healthy thing to do, to discuss if the pros and cons of what decisions they're making and why they're making those decisions.
Mhm.
So I would urge anybody that's listening to take into account the advice of medical professionals, epidemiologists, people with expertise in this. This is keep in mind, this is not our first virus. This is viruses are something we've been dealing with for a very long time, even before we knew what viruses were.
Mhm.
So this is not the first time we've dealt with a virus. This is something that we as a healthcare profession have prepared for our entire careers,
Mhm.
and had practice with different various and sundry illnesses.
Mhm.
Um, so the medical expertise is based on history.
Mhm.
Um, and we know that these types of decisions have ramifications. And we can hope that we can trust our politicians. We can hope that they give us good, solid advice, and that the decisions that they make are after gathering all of the knowledge possible and with as little external influence as they can be.
Excellent. Well, excellent. Dan, thank you so much for taking the time to talk
My
with us.
pleasure.
Really appreciate your expertise. Hope everybody stays healthy down there in Pass Potato.
Likewise. I appreciate the time, and I hope everybody stays safe.
Yes, sir. You take care.
Thank you. You too.